So welcome everybody. We are back. This is day 4 of Vaccine Week. Today's topic, very interesting. We're going to be talking to basically, people from the community, esteemed people from the community, kind of discussing, the concerns, what people have been hearing about the vaccines, and our own perceptions. And I can say, at least before I introduce everybody, that all 4 of us have gotten vaccinated. So we all have our own personal story to share as to why we decided to do it. So let me start off by saying that welcome. My name is Manuel Castañeda, Director of Community Health at New Brunswick Tomorrow. And as always, my partner in crime, Mariam Merced, Director of Community Health at, you know what, I always mess this up, Mariam, because it's too long. It's Health Promotions Program, the Health Promotions Program at Robert Wood Johnson University Hospital. I think I got it right this time, so there you go. So we have 2 esteemed guests with us today from the NAACP's New Brunswick area chapter. So I'm going to introduce them, but then I'm going to ask them to just say a bit about themselves as well. So we have Tony Hendricks and Bruce Morgan. So welcome, guys. Thank you so much for being part of Vaccine Week and talking about, just the concerns that we have in the Black and Brown communities with respects to the COVID-19 vaccines. Please feel free to introduce yourselves. Let us know what you're about, what the NAACP is about here in New Brunswick.
All right, Gracie. Great. Thank you, Manuel. I'm so happy to be a part of this project. My name is Bruce Morgan. I'm the president of the New Brunswick Area Branch NAACP. I'm also the first vice president for the New Jersey State Conference of the NAACP, and I sit on the National Resolutions Committee on the national level of the NAACP. Our branch actually serves 14 municipalities around Middlesex and southern Somerset County. So that's where I am, and that's who I am. And I'll introduce you to my dear friend, one of our compadres, my partner, somebody I love and consult with very much, Tony Hendricks.
Thank you, Mr. President. And thank you, Manuel, and my dear sister, Mariam. So I'm happy to be here. I am a member of the same branch as my president, Bruce Morgan. I am a 3rd vice president of the branch, and I am the chairperson for our community outreach civic engagement, which is why I know these individuals so well, and we work on many issues. So I'm delighted to be here fully vaccinated.
That's great to hear. So let me just kind of put it out to the group. What have you been hearing in terms of concerns of the community? I know I kind of started this conversation, or before we went into introductions, laying it out that we've been hearing concerns from the community in terms of being reluctant or not necessarily sure about getting the vaccines. What have we been hearing? Let's put it out there.
It's so frightening sometimes of what you hear out there. And it's also so surprising what you hear out there. We hear everything from the vaccine is a trick by the government to do all kinds of things to our bodies, to, oh, it's a miracle cure and you must take it. And once you get it, you're fixed for life. But that's why I'm so happy we had this conversation today to dispel a lot of those myths, maybe confirm what we feel to be the truth. I'm definitely a layman. I am not a scientist, but I try to educate myself to the best of my ability, and I'm trying to educate my community to the best of the community so they can make the best decisions for themselves.
That's right.
And there's so much misinformation that makes its way into the community through unauthorized sources like social media. Where anyone can put forward an opinion, and it's not necessarily opinion found in facts. So we get all kinds of really interesting, far out types of inquiries about it. Everything from it's just a cold, there really is, and to the fact that the vaccine is not it's not approved. So I'm not going to get any vaccine until it's approved by the FDA. So we're hearing everything out there.
So what do we say to our people when we hear that, their main information is coming from social media? Where can they get that information?
Well, one of the things we do, Marion, is we point them to you and your organization. And our branch secretary, Deb Morgan, is fierce with sharing the factual content that's put out by organizations like yours and Manny's and others. So, and in addition to that, we have provided to the community through our direct branch meetings. We bring in, Miriam, you've been with us twice already since this outbreak. And we bring in people who can bring factual information to the community, right, Bruce?
Yes, definitely. And what we also tend to do when we bring information to the community, we also source that information. It's not that I heard. If we've heard something, we will tell you where we heard it from and direct you to the information so you can read it and make your own evaluation to it. Because we don't want anybody to think that we are making up what we tell our community. So we let them know we are actually relaying information of people that we believe are subject experts.
You bring up a really great point, right? Make sure that you double check where you're getting your information from. Miriam loves saying this, and I completely agree. So I'm going to steal your thunder, Miriam, right? We all love our neighbors, we all love our relatives, but they might not be the right people to take advice from,
Yes.
right? Not to mean that they're coming from a bad place, but they might not necessarily have the right information or or the most accurate information. And so this is one of those times I think we can all agree, and join me if you agree on what I'm about to say, is that we should really trust our medical professionals. We should really trust our scientists, that they're giving us the most accurate and correct information that they have available.
Yes, exactly.
And we here in New Brunswick are fortunate to have a university around us, that created the saliva test, So I think that we are very fortunate to have those kind of resources. We have to make sure that they also have people that look like you and me to talk to our community, that speak our languages, so people then have that trust immediately rather than creating, in the future, that trust. We need that trust right now in order to be able to trust the medical community. But we are blessed here with, throughout this week, we have interviewed all kinds of races of people from different backgrounds that can understand the issue of the vaccine. But I think organizations like yours are critical in our communities, that you have the ear of our community at the ground level, and you're listening to what are those barriers, what are those things that are preventing us from have a healthier life. And I've been blessed to be invited a number of times to talk to you, and also that health in your organization is a top priority, right? That when we talk about voter registration, we're talking about health. When we're talking about school issues, we're talking about health too. So I think that that's one of the most impressive things about that I've seen in your organization, that you're always bringing health to the top of the needs of our community.
Yes.
Yeah,
it's actually a focus area that is coming down from our national level, that there are 4 focus areas for 2021, and healthcare continues to be one of those areas. And Manuel, if I can, you mentioned family. I have an absolutely brilliant daughter, very accomplished, college graduate, the whole 9 yards, who at some point, I don't remember exactly when it was, sent me a video that had been sent to her saying, "Oh, you've got to see this." And it was incorrect. It was targeted towards our community, made it look like the people who were giving the information were from our community, and it was totally incorrect. Thank goodness she sent it to me. Her sensibility said, listen, this is so bad, I've got to share this. So it is happening. It's happening if through our families. If she didn't have an outlet that she could go to and say, oh my gosh, this is horrible, look what they're doing through the vaccine to us, then she would have put it out on her extensive social media. And people, I mentioned who she is as a quality individual, because if you get those individuals to start sharing it, all of a sudden it has legs and it becomes real. So I just wanted to give you that personal anecdote.
Yeah, I think that speaks. Oh, go ahead, Marian.
I just want to say that I just want to take it back to those sometimes difficult conversations that we're having with people that are very close to us, right? I had a very difficult conversation with my oldest son about getting the vaccine, right? And anything that he told me, you know, about distrust in the government, about how he felt, you know, this last 4 years with the administration and the treatment of people of color, you know, I had to agree with it. But then what happens? What can we talk to? How can we talk to our young people? And eventually he's getting the vaccine today. You know, we continue to have that conversation, and we were able to agree that, you know, this is to save your family, your community, your race. You know, we are at that moment in our life that we need to make the right decisions, and he's an adult now. But Tony, how do we talk to our young people and acknowledge that what they have been through, it's real, but that we need to move on?
Yeah, this ties into so much of the other work that we do as a civil rights organization, where there's a deliberate attempt at misinformation to prevent our participation, if you will. And I find myself now, I was just interviewed by Collabs on Monday and it's part of that process of getting in front of the young people and helping to address the issues and helping to make sure that we're honoring and respecting their viewpoint, but providing to them information that they can, you know, they can then take into consideration and counterbalance. But it is it's a challenge, Miriam. And by the way, my daughter got vaccinated the same time I did. So we, you know, and Bruce.
Yes.
We have our Rutgers influence, right?
Exactly. We have a chapter called the Rutgers Scarlet on Rutgers campus. And this is once again why I say the importance of sourcing our information, because they do a lot of reading, and they also, I'm very proud of them that they will send us a lot of information that they read about, and they will source it. Because and I'm not a researcher, but anecdotally, I would say most of the time when I hear a myth, it usually comes with the caveat, well, I've heard or somebody told me. They very, very rarely will be able to point to, you know, I read this in this magazine or this book or such and such a doctor said so. You know, it's the old gossip mill, you know, and that's why I believe, you know, you can source it. There are, of course, you find rumors often coming from a bad source, but when you try to see where that source got it from, somewhere along the line, if you like reach it back to the root, I would say the majority of the time you will find they do not have a solid source that they can attribute what they're saying to. And that's why I was really, when Tony told me about her daughter, I thought it was great, because her daughter is somebody that I've always known to be very intelligent, you know, and very cognizant of what's going on. And when I found out she got the vaccine, I'm saying she must have found the source to override what she heard.
Yeah, I think what you say, I think that there's a lot of values or things that I definitely want to point out. Number one, this is not an issue about being smart or not being smart, right? That has nothing to do with that. It's just about understanding that in this day and age, there's a lot of information out there, right? And some of it, not from reliable sources and not correct information. And all I think that we're all saying is, listen, there is correct and accurate information out there. and that you should really seek that out before you take something into account, right? One thing that I would also add is, I know that we've been focused on the younger community, but I think we also have to focus on the older community, right? Historically, our communities have had a distrust with the government and with corporations just because of just abuses in the past, both in the Black and brown communities. And I think it's important to address that as well. Wouldn't you agree?
Definitely. And I found, when I've spoken to citizens who are senior to me, because I consider myself somewhat not a senior citizen, I'm a seasoned citizen. But some of those that have a little more seasoning than I. And I find a lot of them, they are receptive to what we say. If we can talk about the historical context of what has been and some of the evolutionary changes that is. And when you can make that connection for them, I find and with the vaccines, a lot of other kind of myths that have been, generationally passed down or misconceived. When you make the connection of the continuum of life and how cyclical or evolutionary things are, we all tend to learn that what we're saying has a lot of sense. When they talk about a generation gap, even when we talk to the younger generation, if we can make the connection of the evolutionary change and how things evolve, it makes sense. The circle of life is very much true. And it's just a matter of us understanding we can't always, I have an expression say, we can't always think we're the hub of the wheel. We're just a spoke running around like everybody else.
Yeah, and if you think about other health issues that have inordinately impacted older Black community, I always think about men when it comes to prostate cancer and women when it comes to breast cancer. And may God rest my husband's soul, he never missed his PSA test. But did he want or invite or even like to have, the prostate test? Oh, heck no. But what happened is through community organizations and through his fraternal organization, they would show up at any of the mass conferences and gatherings and give them, say, you're going to take the test as part of the conference. This is why what you all are doing, Mariam and Manuel, are so important, that you're taking the time to go directly to the community and say, we're telling you this because you're dying for no reason at all, okay? And this is a message, I think, that we have to be very blunt with that message. We die disproportionately because of many factors. Don't let one of the factors be because we're not getting tested and we're not taking the vaccine. We may not be able to control working outside of the home and our living conditions and our access to all kinds of other areas. But by golly, when those pop-up tests become available and the in-home tests become available, and when the vaccine becomes available and people want to give it to you, you've got to take it, because it is literally a matter of life and death. And with our older community, I know that we have to do that, because I always say things like men should not be dying from prostate cancer, but Black men do, because they don't participate in the testing. Direct correlation to what we're talking about today related to COVID. So thank you for bringing up the older generation, because we can't forget them. We have to make sure we're hammering that.
And I think, one of the best ways to kind of send that message home is to talk about our own experiences, right? We've all stated that we've gotten vaccinated. And so what I'd like to hear from each of us, and I'll end up being the last one to talk, but if we can all just take a few minutes to kind of give our personal reasons as to why we decided to get vaccinated. So Tony, why don't we start with you?
Well, for me, there was never any doubt. Being a widow, living alone, I can't afford to get sick. I can't afford to get sick. And the other reason I got vaccinated is for my family. They can't afford to lose me. They just lost their dad. So we, as senior citizens, I'm a senior citizen or a seasoned citizen, in our community have to realize, as Bruce referenced, the circle of life. And we have to do everything that we can in order to support that. So for me, it was never an issue. Coupled with the fact that I did avail myself of the source information so that, I could really understand what it was all about. But I did it for me, not because I can't afford to be sick. And I did it for my family because they can't afford to lose another family member.
Thank you for your honesty.
Thank you. Thank
Yes.
you, Tony.
Bruce, how about you?
I-
What tipped the scale for you and say, I'm going to do this?
I have my card right here for my 2 shots.
Congrats.
It's pretty much like Tony. I did it for my family. I want to be around, and I want to be able to see them and to hug them. It was so sad when I had to have Christmas with my son on my front porch. When I had to have Christmas with my daughter on the stoop of her house, where I wanted to hug them and kiss them because I'm a hugger and a kisser. And I understand that taking that vaccine, it might give me the ability to do that again. I've also can say that I did serve on the IRB at Robert Wood Johnson for many years. And I understand all that goes into the research and that what is done to make research where people are not put in danger or they have the be exposed to adverse effects. And I understood that what's going on with this testing and came from the research that time and time again for many scientists went through to prove this stuff is right. We have to understand that with the vaccination, that is not the research. The research has gone. Preceded this for many years. COVID is not new. I looked on the back of a disinfectant can, and I saw that it talked about killing the COVID germs. And I did some research on it, and this was on the can for at least 15 years. COVID is just a strain of a disease. So I wanted to get it. I did, like Tony said, I tried to do my research to learn about it. And I want to be able to hug my children, and I want to be able to be around others and not feel like that I'm exposing them to any kind of danger. So I was, when I heard that the vaccine was coming out, I was just sorry I wasn't the first one. I wanted to be that one on the news, to be the first. This is the first one, but I'm glad I got it. I definitely recommend it to everybody, and I'm not a medical professional. But I think the risk that people worry about, I think it's more of a risk not to take the shot than to take it.
Thank you, Bruce. Miriam?
So I have to say that, the first thing that started moving me into, I need to take this into consideration, is when I saw those original presentations that we all saw from Dr. Don, and we saw in that chart that the people that got the placebo all got infected with COVID, and the people that got the vaccine, the line, they did not. And I said, oh no, wait a minute, this is effective. It doesn't get all the fears that I might have of the third eye or whatever. I want to be out of this situation because we're family people, we're people, right? We are always out there talking to people, engaging people in doing whatever it is that we're promoting. And we felt like we were in jail, right?
Yeah.
My office could go home and work from home. And I said, I don't think so. I don't want to go home. I want to stay here. I knew this is going to have a big impact in in this community that I serve at. So those were my reasons. You know, I had COVID myself, and my husband and my kids and my dad had a bad reaction to COVID. He's home, and I'm happy for that. But my dad took the vaccine himself. And when I asked him, why did you do it? And he's like, I believe in vaccines. You know, you guys grew up all healthy and you all got your vaccines. I don't know what's the big deal. And he's 87 years old. So I said, you know, we have to do this. We have to do this as a family. And here we are. The last one just texted me that his arm hurts.
That's great to hear. I mean, I'll just piggyback on that, that I think it's important that, you know, we got to put our money where our mouth is, right? You know, and if we're the ones promoting that you should do this, then we have to step up and say, and do it, right? So that's one of the reasons I decided to do it. But much like everybody said here, I did my research, right? I looked at the clinical trial information, and yes, I mean, it was without a doubt, if you really look into this, you'll see that people who had the placebo, you know, had COVID, you know, dramatically more than anybody who got the actual vaccine. And so why wouldn't you want to protect yourself? You know, and I know a lot of people will say, well, I know people that it didn't really, you know, affect. And yes, that's all true. You know, some people will be lucky enough to get COVID and not have it really affect their lives. But the reality here is you don't know how it's going to affect you until you actually have it. And do you really want to risk being one of those that end up having to be on a ventilator in a hospital? I didn't. And even though I didn't, I unfortunately also got COVID, and I was knocked out for 2.5 weeks. It's 2.5 weeks that I wouldn't want to repeat anytime in the future. And so, you know, for me, you know, the research, you know, on the information. So please, you know, as you said it, Tony, look for those credible resources. You know, we make it a point at Live Well We in New Brunswick. I know Mariam through the hospital and Su Salud New Brunswick make it a point to only provide accurate information that's proven to be correct, right? Look for those sources in order to make your decisions. But the only thing that I'll add is just like all of you, you know, we wanted to make sure that not only we're safe, right, but that we were safe for our families. You know, I have parents that are seniors, and, you know, want to make sure that I'm there. And the last thing I want is to be the one that gets them infected, right? And so, you know, but on the flip side, I have younger children, right? And although children are, you know, it's not prevalent in children, you still have to be careful and you have to care. And so I want to make sure that, you know, to your point, I want to be there for my family, and I want my family to be there for me. And I have a strong commitment, you know, working in public health, to be there for my community, right? And so I want to make sure not only am I showing an example, at least I hope I'm showing the right example, right? And I'm showing an example based on the best evidence that we have today. Are any of us saying that this is the, you know, 100% foolproof way of going? No, but based on the scientific evidence that is provided to us today, this is the best chance and the best shot that we have to put this virus under control.
Yes.
And I am basing my decisions on that premise, right? And so that's me moving forward, right? And happy I got my shots. I got Moderna. Second shot, felt a little loopy, but other than that, I'll take that over the 2.5 weeks that I had to deal with COVID, where I didn't know what to do on myself, to be quite honest. So thank you for sharing your personal experiences. The only thing that I want to kind of bring out, because one of the areas that we want to talk about today before we leave is scams, right? Because unfortunately, not only do we have to worry about misinformation, we have to worry about people trying to take advantage of the fact that people are afraid, whether they want the vaccine or they don't want the vaccine, right? And I'm going to share my screen just because I think this is an important graphic to provide. Okay. And, you know, one of the major things that I think that and you guys let me know if you agree, but, you know, people are, you know, I've been hearing this as well, that people are calling people saying, hey, if you pay a certain amount of money, you know, we'll get you on the list, because I know a lot of people are having difficulties getting appointments. You know, I'll get you on the list earlier so you can bump and get that, you know, get that appointment. And you know, want people to make sure that anytime anybody is telling you that they can get you an appointment for money, it is a scam. Do not believe them. These appointments are free. It's part of what we're providing, that's being provided by the government and other institutions. No one should be charging for the vaccine, period. And no one can get you access to the vaccine quicker by you paying money. So, because we've been hearing a lot of that. The other thing that I think is not only related to the virus, but overall, and I hear this from my parents. People call my parents are both senior citizens, and unfortunately, they get a lot of these calls, where they get calls. Hey, we need your social security number in order to verify X, or please give us your bank account information, or I need your credit card information, right? And never provide this personal information. Nobody, especially from the government, is going to call and ask you for this information, especially about the virus, right? So I'm sure you guys have probably heard this or maybe even experienced it yourselves. So I just wanted to reinforce that these are important things to really point out.
I just want to say that, when many of the sites, when you register to get the vaccine, they will ask you for your insurance. If you don't have insurance, it's okay. FEMA is paying for the vaccine, but the insurance will pay for the administration of the vaccine, like the cost of the hospital or the clinic will have in administering you the vaccine. The people that register you, that's the kind of cost that it will go through your insurance. I think this is very important information because we already have started seeing this in many of the local factories here, that they're saying to the employees that they will charge them to get the vaccine. So call us, call the Department of Health if this is happening. They are aware that it's already a scam. So it's important that we give this information to the community. And so far, I am so happy that we had this time together to talk about, how to talk to our young people, how the importance of talking to our health professionals rather than our neighbors and our aunts and uncles. That we need to acknowledge and respect our past, with our young people, and also talk to them about moving forward, about taking care of ourselves as a community. And I think that it's important that we share these stories and that we tell people how we came to the conclusion that it was important for me and my family to get the vaccine. So I want to say thank you to Bruce and Tony for always being there for our communities, for giving that extra step of information, of showing up when we need for you guys to show up. And I know that vaccine is for you to go out. I know that.
Yes.
We've been saying, when are we going out for lunch?
Yes.
So I appreciate all your help and all your support over the years. And Manuel, we'll be back tomorrow, right?
Tomorrow. So yes, once again, thank you, Tony. Thank you, Bruce. We really do appreciate you providing your experiences, your insights, to address, the myths, being able to talk about, being careful for scams, right? Our community,
Yes.
We have to protect our community, right? We have to make sure they at least know what the right information is so they can make the appropriate decision. But we'll be back again tomorrow. So we've talked about, the vaccine. We've talked about, appointments and the process of getting appointments and clinical trials. Today, we talked a bit about, just scams and myths and why you should get the vaccine from personal experiences. Tomorrow, our last day, we're going to be covering, so you're vaccinated, now what? The do's and don'ts after you get vaccinated. That's for tomorrow. So once again, thank you. And to everybody listening to our little podcast or our little presentation, I don't know if it's a podcast, so let me not say that. Our little presentation, have a great night. We'll see you tomorrow.